welcome everybody. It's Katie with Ria Health, and today I'm here with two special guests. I have with me Mike Pond and Maureen Palmer. Mike is a Vancouver-based psychotherapist who specializes in addiction treatment. And Mike, you do so from both a professional and personal experience. Because as I know from reading your book and watching your documentary, you had become a successful therapist and a family man and really had a life that depicted success, especially to the outside world. However, your alcohol use started to get out of control, and it kind of led you down a path of a long and really painful battle with alcohol addiction that ultimately destroyed your life. However, we have you sitting with us today, so we know that your addiction story does have a happy ending. And you've done such an amazing job telling your story. I have your book here. You have this book, Wasted, An Alcoholic Therapist's Fight to Recovery in a Flawed Treatment System, which you co-wrote with Maureen. And Maureen is a filmmaker and Mike's partner, and you both also co-created a documentary about the experience, which is available on YouTube for free. And I'll be sure to link that below this video. But both are just very raw, honest, real depictions of your struggle and ultimately finding your way out of that experience, and now how you're helping others and really raising awareness about evidence-based treatments for alcohol addiction. So just want to, really say thank you and welcome to you both. I'm excited to chat with you today.
Thank you for the opportunity.
Thank you, Katie.
Yeah. Absolutely. So I want to just kick it off, Mike, with you. I know, you are the epitome of how alcohol addiction doesn't discriminate. As I said, you were a successful therapist, you had a beautiful home, a family, and really, had this successful life. But as I understand it, by the age of 50, I think it was, you really lost everything, and I mean everything, to alcoholism. So can you just begin by telling us a bit about your story for people who aren't familiar?
Sure. I was a therapist in an area in British Columbia called the Okanagan, and it's kind of our resort area. So we lived on a lake, we had a beautiful home, and 3 kids, and kind of the epitome of a happy, successful family. And then my late 40s, my alcohol use started to escalate quickly. I do have it in my family. My father was, and my grandfather. So I started drinking really, really heavily, and it eventually led to me having to leave my home. And from there, of course, I was living alone, and then the drinking just escalated and got so severe that I lost my practice. I had a successful practice in our community, and ended up on a Greyhound bus and fell out of the bus with my bottle of vodka on the downtown east side of Vancouver, which I don't know if you're aware, that's the area where we have most of our people that are suffering from addictions and mental illness and homeless and penniless. So yeah, and from there was able to, that's a whole other, well, you have to read the book. So I don't want to give you the book, so maybe Maureen can step in.
Maybe I'll fill in a few gaps. Mike's drinking got so bad that, he would bury bottles on the beach near his home. The Okanagan is Canada's wine country, so alcohol is part of every aspect of lifestyle up there. Hidden in the toilet. One day when all the leaves fell off in the fall on a tree in the backyard, a vine, now called the vodka tree, dozens of little bottles in it.
Well, my hidden bottles were discovered.
Mike ended up in the worst snowstorm in the Lower Mainland in 50 years, because we hardly ever get them, passed out on a beach. And, a couple found him. He ended up in the drunk tank, and that began his long slide through a series of unregulated recovery homes where AA was the only option to get well. And he didn't get well. He didn't end up well until 28 days with severe pneumonia.
Yeah.
Wow.
So like I said, it escalated so quickly, and thank you, Maureen, for filling in those gaps. Some of those significant pieces I leave out.
Understandably so. Oops, I forgot about that. No.
Yeah, but being on the street and being homeless and being penniless and having no one in my life and experiencing that firsthand, has really given me a much deeper and profound level of empathy and understanding. And it's really helped my practice, even at my late age. Yeah. And so we may see, we can look at this a lot of different ways, but I really see it as really built character and really helped me in all aspects of my life, personally and professionally.
I remember when we started making the film, Michael hadn't had a relapse yet in 5 years, and had the relapse. And we sat down and I started, mapping out the story. We knew we had to make the relapse part of the story to be real, right? We don't even use the word relapse anymore, right?
No, we don't use it. There's a lot of words we don't use
recurrence.
Anymore. Yeah.
And he said to me, we have to really examine the science around Alcoholics Anonymous and 12-step facilitation, because the program in Canada is, for the nature of things, our flagship science program. And when we dug deep into the studies, we were both kind of surprised and shocked that there was so little efficacy behind it, yet everyone was forced into that mold. And
I was wondering why, I was working so hard at AA. I was going to 2-3 meetings a day. Wow. and doing the steps over and over and over again. And it just wasn't working for me. And I went, is there something wrong with me? Like, am I that flawed? Am I that, messed up? And always feeling like a failure. And when you feel like a failure, of course, when you have this problem, what do? You drink. Yep. So it was this vicious cycle, and I call it the spiral to hell. And so when I met Maureen and we started to, we decided to write the book, I said, we've got to really challenge this program, because everybody is sent there. My own doctor over and over again would tell me, go to AA, go to rehab. And it just wasn't working.
Yeah.
And we found out it doesn't work for a lot of people. So there's lots of options.
A scenario you painted in your book really sunk in and stood out to me. And it illustrates really the challenges in finding addiction treatment. You ask your readers to imagine, if their family member had been diagnosed with cancer, and they go from there, they had to blindly search online for medical guidance or for treatment, but without any medical guidance for that treatment. Then they're faced with hundreds of private options, that aren't shown to be effective or aren't proving their efficacy, and they're expensive and not regulated. So the quality isn't guaranteed. However, you still have to pick one to get your loved one treatment, hoping it's the right one. And they get the treatment and they go home and the cancer comes back and you have to do it all over again. And that comparison really sunk in for me. And so I just wonder, and you talk about that a lot in your book, is there more you can say here about that treatment system?
Yeah, well, probably this is a complex biopsychosocial problem, right? So it's not straightforward. It's not simple. It's not just about being abstinent and not drinking. There's so much more to it than that. And as I said, all the doctors, I'm in the field. I knew a lot of doctors. They don't know much about this problem, and it's not really their fault. It's in med school, they get 4 hours of training on addictions. I mean, that's ridiculous. It's not a specialty. So I would say that was the number one barrier, was getting Dr. One to prescribe medication that's approved, by the American Medical Association. And then then it's time to go, okay, now I need to go for treatment. Now I need to go to rehab. But as you said, well, I don't have $30,000, right? And, but I have to go into this government facility, but there's a 3-month wait. So go ahead, Mom.
We're a little bit different than you. We have national health care, which covers everything but addiction treatment.
What?
Even though it's been to create a medical problem by the Canadian and American medical associations for more than 3 or 4 decades, it's still treated distinctly, and I think partly because of the history of it being a moral failing, right?
Yeah.
So I think that the cancer analogy is good, and Dr. Keith Humphreys from Stanford, an Obama advisor on substance use, uses another one. He said, somebody had a really bad infection, and they came back and said the antibiotic isn't working. No doctor would say, well, you just keep taking that antibiotic until that guy gets it, right? We need that psychic shift in our whole culture about how we see substance use. The cancer analogy, people would come back maybe and say, yeah, but addiction hurts everybody else. The cancer really is not inflicted on everybody the way addiction is.
Plus, you're choosing to drink. I didn't choose this cancer.
Yeah, yeah. So, I mean, yes, that is true. But saying that doesn't change things. it still leaves us with a monumental problem with very little treatment and astronomical social costs, 700 billion a year.
Wow. Wow.
Yeah.
That's just for alcohol.
Yeah.
And alcohol is the number one public health problem.
Yeah.
But it's not treated as a public health problem.
I think
Right.
it's slowly starting to change.
Slowly. And you're a part of that.
Yeah.
It's like turning the Titanic.
So I know you've spoken a little bit about this, but what are the biggest ways that you see that our treatment system is flawed?
Well, it's flawed at every level, at every system within the large system. Right from the get-go, 1 in 10 people have this problem, right? And only 1 in 10 of those actively and voluntarily go and seek help, or even talk to their doctor about it. You'd be surprised how many of my patients have been seeing the same doctor for 20 years, yet have never told that doctor that they have this problem.
Yeah.
And it's shame, right? And it's shame from within and it's shame from without, right? So we carry this huge load of shame already, and then we encounter these so-called helpers, and I'm a helper, so I understand this. And they want to find ways of not having to treat you because it's problematic. It's like you're a problem child or something on their caseload. So
how many of your clients have said they couldn't get their hands on Naltrexone?
I would say out of all of my clients that I see, and it's consistent, is about 75% for one can't get a doctor to prescribe it. And if the doctor will prescribe it, there's a lot of resistance and a lot of reluctance. Now that is shifting. It is shifting. I'm seeing that happen over the last few years, but it's still a big problem. Just to get a doctor to sign or to prescribe an approved medication for the treatment of alcohol use disorder, which is
for like 25 years.
25 years naltrexone, right? And that's one of the big problems. And
very few, I would suspect 80% of the treatment places in Canada don't prescribe medication at all. That's slowly starting to change.
Yeah.
But what we are advocating for is a broad evidence-based toolkit.
Ah.
If AA works for you, that is great. We are so happy for you and happy for the population because of its widespread availability, its 24/7 sponsor support, and the fact it's so cheap. But for the significant portion of people for whom that doesn't work, what's over here? And how do we get word out that there is an over here?
Exactly.
Usually there isn't anything over there.
Yeah. Most people aren't aware of it.
Yeah, so you go into the hospital and maybe you see a great doctor that's familiar with how to treat addictions and is well versed in the new evidence-based approaches. But once the assessment is completed, then now where? Well, you're going to have to wait. Like I said, you're going to have to wait months to get into a public treatment system. With the private industry, yeah, they'll take you right away, but you need a whole whack of money to get in there.
Yeah.
So what happens is those people just fall through the cracks. And they just keep revolving and coming. I spent how many times I went to the emergency? How many times?
We calculated 32 trips in total, 15 to the Penticton Hospital alone.
Yeah.
And most times, if you got seen by anybody, was at a van and a bus pass.
Yeah, I'd get an out of van and a bus pass and say,
what?
Sorry, we can't help you. Right?
Oh my God.
And to be fair again, especially Penticton Hospital, that's changed.
Yeah.
A doctor up there has actually printed off a card with our documentary with one of those barcodes on the back.
Yeah.
So he could point people to the book and to the resources that are based on the Canadian Broadcasting Corporation website. Because he saw it, and he did work in the ER in Penticton and thought, well, I can be an agent of change.
Wow.
Yeah. And I, going back, in the years when I was still home and my former wife, my son's mother, she just felt helpless. She didn't know what to do with me. She didn't, I would be detoxing severely in the home and she'd be scared. And many times she'd take me to the hospital and they would say, it's him again. Here he is again. And so then she felt the shame.
Yeah.
And the whole family felt the shame. And that's the other piece to this is the families are not included in the process.
Wow.
And the family is crucial to the process, right? If my family would have known, especially my former wife and my sons, because my sons are older, there's other ways here that we can interact with dad, right? There's other ways that we can be with him, and so that there isn't, and it's not their fault again. It's just what they know, and all.
It's the culture,
and it's just the way the culture is. So back in those years, Maureen's nudging me here under the table. So
now she has to edit.
No, I mean, that's so relatable and so true. And people they get so fed up because the revolving door of the relapse industry. And so I wanted to ask you, there's always that thing, someone choosing to drink. If they had a gun to their head, they could choose not to drink. However, we know addiction is much more than a choice. What do you say to this based on your experience, personally, and also in your practice treating people?
you think?
I think the big game changer for us was when Michael had his brain scanned at the Medical University of South Carolina, and we could see, they show him a series of drinks and gauge his brain activation in certain parts of his brain, and they revealed to us the scans the next day. They showed a normal scan, and then Michael's scan, and then everyone else who has this problem scan, and Michael was startlingly similar, right?
This is after 5.5 years without a drop of alcohol in my system.
So there was no reason to think that those particular places would be activated, but they were. So subconsciously, something is going on in his brain, and we suspect in the brains of many. One of the other things that's in the documentary is a study at Cambridge where Mike discovered he is probably born with low levels of dopamine receptors. People born like that, very often when they hit puberty start self-medicating because they don't know why they feel this way. So
maybe I shouldn't have said, what do you think?
No. I was going to ask these questions anyway because I've seen the documentary and I'm so fascinated by that. So
please. Call that a choice is kind of crazy, right?
Yeah.
Yes, it's an element of choice, but 90% of it, in my mind, is preordained by genetics.
Yeah, and again, just to follow up with Maureen, this is a complex biopsychosocial problem, and so we need to look at the biology. We need to look at the genetics. We need to look at how different is my brain, and I realize that my brain is very different now. A lot of people in my field will argue this, right, and say that this isn't about the brain and it isn't about genetics, and I challenge that. I think that the genetics piece is powerful. And after watching, my brain and seeing what my brain was doing when it saw just images of alcohol, and I wasn't even aware of it, that really was an awakening for me to just how powerful this thing is and how difficult it is. This is the most difficult thing I've had to do in my life, was treat this and get well. And so in working with my clients, I really need to have that, in the back of my mind all the time, right? They'll say, I've been to rehab 8 times and I've tried everything. I've been going to AA. Nothing's working. I can't stop drinking. And so I need to really meet them where they're at and say, okay, well, here's a whole list of options. AA is one of them, and there's a whole bunch of others.
Yeah.
And so you're going to get therapy and you're going to get the right medication, right? And we're going to find you that mutual support group that works or fits for you. And that's the key. It's what's going to fit for this person, right? Instead of pushing them, squeezing them into a pigeonhole of a model that they either don't like or doesn't work for them, or it's just not a good fit.
Yeah. And you said in your documentary, I think it was 40% of people with an addiction also suffer with a mental health disorder. Which,
yeah.
I mean, what more can you tell us based on your experience with that?
Well, yeah, and that's from our research from 5 or 6 years ago. And I think it's a lot higher. I think it's at least 60% and probably higher. Everybody that I see, I know we find out, or I know that they have an underlying, disorder of some kind, or a condition. They have anxiety, they have depression, they have bipolar disorder, they have ADHD, they have a learning disability. I mean, it just goes on and on.
Michael's own brother suffers from severe bipolar. And a few years ago now, he went to a facility in Saskatchewan where the condition of being able to stay for a year was no meds. So he came off his bipolar meds, prescribed by a doctor. And he arrived here on Christmas catatonic. He was in the hospital for 2 months.
What?
Yeah.
No meds at all?
No meds at all.
For him to stay there, he had to get off all of his meds, right? So a lot of these places that are so-called treatment centers or recovery centers or whatever you want to call them, as you said, are they regulated? Are they licensed? Are they monitored? And this isn't anything about faith-based or anything, but this one was run by a Christian organization, and then you had to adhere to that belief system, right? To be there, just to be a client. And that's discrimination to me.
Yeah.
It's prejudice.
The other thing I think that plays into this mental health issue and substance use is trauma. Like Mike calls trauma the gateway drug, right? And if you look at a lot of your clients, pretty well everybody, I would say, on Vancouver's downtown east side, there's a mental health substance use issue born in trauma. Mm. And I think we really, as a society, have to begin trauma-supported therapy on a big scale.
And that's just not those folks from the lower socioeconomic strata, right? I see people from there, and I see people in Vancouver here that are wealthy and successful, and when we start to do the therapy and start to really explore the background, there's trauma, right? And I'm not going to espouse that trauma is the number one, but it is very, very significant, and it needs to be treated. That's another crucial piece. Absolutely. It's missed in the system.
So what's your experience, Mike, personally and professionally with medication treatment like Naltrexone? What have you seen?
Well, in the film, you saw that when I had the recurrence.
Yes, not a relapse. Love that.
After 5.5 years, Maureen, of course, because we were in the midst of making the film and the book had already been written, she goes, "You're not, I was packing my bag to leave, right? Because I'd messed up, I'd screwed up, and typically, historically, that's what I did. If I drank again, I was going. So I was packing my bag, and of course, I would be going to the liquor store." And she goes, "Well, no, you're not going anywhere." And she said, "In fact, we're going down, across the line." So the border is just half an hour from here to the US. And so we went across the line to Bellingham, and the film crew joined us there, much to my surprise. and I had a Vivitrol injection. Yeah. And because I'd been tested at the Medical University of South Carolina, I had the genetic variant that's very responsive to Naltrexone. So it worked. And
Vivitrol, just for your viewers, is the injectable, 30-day injectable version of Naltrexone.
Yeah, that's the long-acting version. And it worked for me. And so I went down for subsequent 4 more injections, and felt that I was okay, and I was fine to go on, and things worked out well for me, and I was so pleased that happened.
And on occasion, Mike will take we have a prescription just in case.
Yeah.
He takes the odd Naltrexone where he's recognizing the potential for some vulnerability.
Yeah.
Works for him.
Yeah.
Yeah, it works for me for sure. And I can share this because I have a son that has this problem. He's given me permission to talk about it generally. And it works for him.
Wow.
Right? He's currently taking Naltrexone. And every one of my clients, it's on the menu of options. And I go over the different approaches with Naltrexone. You can either, take it daily. You can use the Sinclair method. Take it an hour before you drink, and then drink intentionally. Or you can go down and across the line and get an injection.
If you have money.
Yeah, it's very expensive.
Yeah.
And then we have the exchange rate, right? So it's $2,000 by the end of when we walk out of the clinic. So, but I often say to them, "Well, how much do you spend on alcohol? And what how much money gets wasted and
work lost and
yeah. You know, you have to do what I call a cost benefit analysis. How much would you spend to go to treatment for a month?
Exactly. I love that in your documentary because that just made it so raw. Like we were with you on your recurrence experience and Vivitrol. Like it was great for the viewer to see that.
Can I ask you something, Katie? Did you use the expression relapse industry on purpose?
No, did I say that?
Yeah, and I thought, wow, that's really good.
Maybe my unconscious did.
Write that one down. Okay.
Yeah.
That's what it is, though, really.
Yeah.
Wow. Yep. Okay, I need to brand that, I guess. No.
Yeah. You own it, baby.
Yeah. So one thing I wanted to ask you too, Mike, that was mentioned in your book about the disease model of alcoholism and how it's very black and white. You either have alcoholism or you don't. Can you say more here about how that is contributing and perpetuating the issue of problem drinking?
Well, it's a difficult one because it can perpetuate, and yet on the other hand, it can, be facilitated, it can be positive or negative. Because one thing we need to hold the medical profession, the medical industry to task here, because it is, deemed a medical disease, right? However, that also complicates it. So, there's learning theory as well. We learn this, and it's environmental. So it's nature, nurture, I believe, both. So it's just so difficult because through all of this, I've just kind of shed the idea that, I'm not going to really look at this as whether it's a disease or not. It's a condition that you have. And we're not even going to call it alcoholism anymore. We're not going to call you an alcoholic anymore. You have an alcohol use disorder, and it's mild, moderate, severe. And we're going to treat it accordingly, right?
And the moderate part doesn't work with black and white thinking.
No.
Yeah.
When you have that binary thinking, right? Oh, and where's the line? When do I cross the line and become an alcoholic, right? Mm-hmm. And there is no line.
Well, I would say Dr. Greg Sharp in Bellingham, the one who gives Michael Vivitrol shots in the past, he would say the line is, when your life has become hurting you, it's unmanageable, where you've tried successively and you haven't been able to get your life back in order, that's the line.
And another piece of that is, I just read this recently, that we should be part of the general medical exam should be an assessment of your substance use, starting at 12 years of age. So when you go to the doctor as a 12-year-old little boy, a young boy or whatever, that should be, we're going to check your heart, we're going to, check your reflexes, we're going to do all this blood work, and we're going to do this little questionnaire. I'm going to ask you some questions about your, alcohol use or your drug use. And if we catch this thing early, then we're probably going to save a lot of lives. In fact, I know we will.
Absolutely.
Yeah.
And so what about the stigma that still exists in the healthcare industry toward those with substance use disorders? I know you've talked a little bit about things are slowly starting to change here in some ways. What's happening here and what's your view on what we can do about it?
Well, it is changing, and at another level, it's not changing, right? It's still, if I have a mental disorder, if I have an anxiety disorder, if I have bipolar disorder, right, I'm definitely going to get treatment, right? So those of us with substance use disorder, we're kind of still at the bottom, right, when it comes to stigma. And it still takes effort and it takes courage to go in to a doctor. I can go into the doctor and say, I think I have anxiety or depression, or somebody told me I might have bipolar, but I'm not going to go into the doctor and say, I drink too much alcohol, I'm an alcoholic.
Yeah.
Right. And so it's still there.
Well, think about, Mike was in the hospital in intensive care, like on day 27, one of his caregivers, a nurse, was getting him settled for the night and stopped and paused and said,
she went bent down, whispered in my ear, that you put this on yourself.
What?
Mm-hmm.
Oh my God, that just made me like a little bit nauseous in my stomach. That is awful. I mean, that just tells it all right there. I mean, that was one woman, one case, but like that is the perspective.
Yeah.
And it's not, I don't like to blame one person for the culture, right? Like we all are, products of the culture. And that woman needs to be educated as much as the bank teller who, when she saw Mike and he asked for his history, she cut up his cards in front of everybody, right? Like there's a level of stigma and shame that seems okay for you to treat people with substance use disorders like that you would never no other disorder, right?
Oh yeah, and every day in my office, I hear a story like this, right? Maybe not as glaringly evident or obvious, but people still come in with, oh, I know I can't talk to my doctor about this, or I can't talk to whoever about this, and I feel all alone with this, and so it's there, it's still there. Yeah. I don't know why it's not. It is changing, but it's just not changing fast enough.
I think it's because of the downstream damage to other people, and people who support the family and friends. They are sort of enmeshed in an old way of thinking.
Yeah.
But often you have positive supporters and you have negative supporters. Leave him. You're destroying your life. What are you doing? Why are you doing that, right? And I think...
And that goes right up to the upper levels of government.
Yeah.
Our top leaders, right, don't understand this problem.
Yeah.
Right? They may even have it in their family, but they still just don't understand it.
Yeah.
And there's a stigma, so the stigma goes all the way up to the top.
Yeah.
Although, to be one little thing I'd like to add, disproportionately burdened at the bottom.
Yeah.
The poorest in our society, the most vulnerable, in Canada, that's our Indigenous people. They are so burdened by this disorder and the shame of being First Nations and a substance user. Mm-hmm. It's the worst.
Wow.
Yeah, that's been a big part of my practice, work with our indigenous people.
Wow. So just to kind of start, wrapping up here, I want to ask you, from your perspective, Mike, where do we go from here? What's next for the treatment world in making evidence-based treatments and more compassionate treatments that are treating the whole person and not in a stigmatized way? What do we do to make these more accessible?
Go ahead, Abby. You took a big breath.
Follow the money. For the people who say, why do I have to pay for rehab again? Or like say it's a workplace program or a government. If we don't find a way to make treatment broadly accessible, community-based, we will continue to spend downstream way all out of proportion than the actual individual problem. More prisons, more courts, more social services, more apprehending kids, more educational problems. If we don't want this over here, and I believe your government now has $1 trillion debt, solve this problem over there. Treat people compassionately, early with evidence-based treatment.
Stop filling your prisons with us.
Yeah.
Right? They've criminalized this problem, so that's one of the big areas. And also the industry, right? In the United States, it's a $40 billion industry. It's a money-making, you can invest in this treatment industry. And to me, that's insane, right? This is the most serious public health problem. And so it needs to be treated that way.
Pushing back gently, pushing back more vociferously on occasion, you have to do that.
Yeah.
And more people that have the capacity and the ability to tell their story and get it out there and feel free to do that, right? Mm-hmm. And that's what's going to change things. It's people's stories, right? That have lived experience.
Yeah.
And to be able to kind of let the world know, look, I'm a human. I was on the street and I learned what it felt like to be invisible.
Yeah.
People would walk by and you'd be holding out your hand, panhandling, and you wouldn't even get a glance.
I want to credit a new generation of doctors too. There's a young doctor in Vancouver, Dr. Evan Wood. He really is a game changer when it comes to what's happening here. And when we spoke to Dr. Steve Eichelberg, then the head of the Betty Ford Center, he has a foundation. And he read me the mission statement And I was gobsmacked. It was to prevent the harm done by doctors to their patients for not properly treating their substance use. He says it's medical malpractice.
Wow.
This is the medical director of
Betty Ford
Betty Ford.
in
Palm Springs.
Wow.
Yeah.
Yeah.
To
That's
prevent
incredible.
the harm being done by doctors.
Wow.
I think the medical profession could really push this thing forward if they would get on side.
Well, that's what the foundation does. It trains young doctors in evidence-based treatment.
That's amazing. Yeah, because like you were saying earlier, and I've seen it a lot with people too, because I'm very familiar with Naltrexone and the Sinclair method, and people just, their doctors flat out saying no, and people have told me this is a life-saving medication and they won't give it to me.
Yeah.
Crazy.
It's baffling, isn't it?
Yeah.
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 Well, I want to thank you both so much, Mike and Maureen. Thank you so much. Want to ask you, where do people find you? I'm going to link your documentary below this video. Where can they get your book and more information about you?
Okay, well, there's my website, michaelpond.ca. .ca is Canada.
Not California.
Not California. Oh yeah, just michaelpond.ca, and we have all the links there. And Maureen, where else can?
Amazon.com, you'll get the book, and Audible. We now have an Audible version.
Awesome.
If you want to go on a long trip, you can take Mike with you.
Yeah, you have to listen to me for an 11 3/4 of an hour.
Yes.
And you know, we get a lot of emails and we try to answer them all.
Yeah, we do.
And they can contact you through your website.
Yes.
That's
Okay.
right.
Yeah. That's our dog licking her water in the background.
Yeah.
My apologies.
Yeah.
It's still the raw and real. No, Mike, thank you so much for sharing your experience, for being that light for people, you know, going through all of that, just to share your experience and really raise awareness as you are. And thank you, Maureen, for helping to tell the story and put all of this together.
Welcome.
Yeah.
Thank you.
She's
All right.
amazing.
She is amazing. I sense that.
Did I win the lottery or what?
Yeah. Exactly. All right. Thank you both so much.
You're welcome.
You're welcome.
Bye.